Good morning. My name is Dr. Lily. Just going over your chart here and seeing who you've worked with before you came to us. As you probably know, since you've had your teeth done before, you won't be seeing a hygienist. It'll just be me because you need to have somebody who's licensed to do ENT work and dental work. So I'm going to be doing your cleaning today, okay? Let me get my mask on here so I can take a look. And worry not, I've worked with other patients who have their teeth in their ears before. We need to start though by looking at your gum health, especially for people like you. Your gum health is even more important because it can affect your ability to hear. So I'm going to be going over your teeth and checking all the indentations between your gum lines. Let me see how, let me get my recorder going so that I can put it where we're kind of short-staffed today. Well, the hygienists are working with people who have their teeth in their mouth. So, 1 second. Okay, no, we'll do this. Okay, so you haven't been having any pain or you haven't noticed any difficulty chewing. Okay, from what I can see, I'm just going to do a little bit of looking around here and seeing what your gum health is like. I have a tiny little camera on my pick here that helps me take a look. Your gums look really healthy, which is always good to hear, but I am going to do a little bit of recording. Okay. Alright, we're going to start in the back there. Two, two, one. 2, 2, 2. 2, 3, 2. 2, 1, 2. 1, 3, 2. 2, 3, 2. 2, 1, 2. 2, 2, 2, and 2, 2, 3. Okay. Bottom row. We'll be doing the other side too. Then we'll do a little bit of a cleaning. It looks like you've got not very much plaque, so we're not gonna have to clean that much. 2, 1, 2. 2, 3, 2. 2, 1, 2. 2, 2, 2. 1, 2, 1. 1, 2, 1. 2, 1, 3. 3, 2, 2, 1, 2. 1, 2, 1. 1, 1, 1. 1, 2, 1. 1, 3, 2. Okay. It's a little hard to get to the back of this side, so I'm just gonna kind of move stuff around here. Okay, I have to use a different tool for this. 2, 1, 2. 2, 3, 2. 3, 2, 3. 2, 2, 3. 2, 2, 2. 2, 2, 1. 2, 1, 1. 3, 2, 1. 2, 2, 1. 1, 2, 1. And 3, 2, 2. Okay. Alright, last side on this side, and then we'll go to the other one. Let me get both my tools and my ears. How's your comfort level? Good. I know this must be an ordeal for you usually, but I actually kind of the foremost expert in this in the state, so yeah, you're in good hands. 2, 1, 2. 2, 3, 2. 3, 2, 3. Yeah, 1 second. Let me finish this up. 2, 2, 2. 1, 2, 1. 1, 2, 3. 2, 2, 1. 2, 2, 3. 1, 2, 1. 2, 1, 2. Okay. Yeah, sorry, to answer your question. We just have an automated voice program that recognizes when I'm saying numbers. Yeah, it's in your chart already. I don't have to do anything later. So let's see here. Yeah, I'm going to take a look after we're done counting your gum line here. I will take a deeper look back there to look for anything we need to clean up. We'll do a little bit of flossing, and then I'm going to teach you how to brush properly. It looks like you're doing a pretty good job, but people with this condition obviously need to take certain steps. Do you have any, like, hearing loss with that? 3, 2, 3. Okay. 1, 2, 1. 2, 2, 2. 2, 2, 3. 2, 1, 2. 2, 1, 1. Yeah. 3, 2, 2. 1, 3, 1. 1, 2, 1. 2, 2, 2. 2, 2, 3. And 2, 1, 1. No, it's actually fabulous. Just checking to make sure. You haven't gotten a single 4. Your gums are super healthy, which is always really good news for people with this condition. Cavities are a lot easier to fix, but gingivitis is a huge problem. Okay, we're gonna get behind. I need my little... Okay, 2, 3, 2. 2, 2, 2. 2, 1, 1. 2, 2, 3. 1, 2, 1. 1, 2, 2. Yeah, just checking. 2, 2, 3. 2, 2, 1. 2, 1, 2. 2, 2, 3. It's almost a 4, but with the new brushing habits we're going to teach you, we're going to get that even down lower. 3, 3, 3. 3, 3, 2. 2, 2, 1. 2, 2, 1. Okie doke. Let me just make sure that all came up. It's sometimes a little bit flawed. Every once in a while I have to make a correction, but I have a pretty good memory for that these days. Yeah, well, you probably felt I'm putting a small tube to kind of help direct my tools. That keeps me from damaging your eardrum while I'm working on this. Okay, 2, 1, 2. 2, 3, 2. I can say 3, 1, 3. 1, 2, 1. It is really nice working with patients like you because I could chat the whole time. Everybody else has their mouth open. 3, 2, 1. 1, 2, 2. 2, 3, 2. 2, 2, 1. 1, 3, 2. 1, 3, 1. 1, 2, 2. And 1, 1, 3. Looks good. Computer's being a buddy today. Alright, last side, and then we're going to get to some cleaning. Let me adjust this little tube. Okay. 2, 1, 2. 2, 1, 3. 2, 2, 3. 1, 1, 2. 2, 3, 2. 2, 1, 2. 2. 1, 2, 1. 3, 1, 2. 1, 3, 2. 1, 2, 2. 1, 2, 2. And 1, 3, 1. Okay. Looks good. I'm going to take a quick look in your ears now to see where I need to focus the tartar control, right? To scrap the plaque off and stuff. It looks like you do a pretty decent job of brushing, but you're missing the back on some of the teeth here, okay? I'm going to send you home with a special brush today that's designed exactly for people with teeth like you. And I'm going to show you how to use it, okay? We'll do a good brush. It is, okay, I need to work on the bottom quadrant there, pretty much. Depending on, like, if you're left or right-handed, usually there's a spot in your mouth you tend to miss more, which is going to be true even more for you because you have them on the side of your head. So it's a lot harder to reach certain quadrants for you. So we're going to give you a brush that's going to help a lot with that. Okay. Yeah, and I can see that by your brushing habits. Okay. This one, 2 of the quadrants need a lot more cleaning, so okay, so yeah, that's what we're gonna do. Then I'm gonna show you some really cool tips to flossing your ears, your teeth. Yeah, it can be really hard, but because people with your condition have much wider, like, openings, I generally suggest they use, like, flossers. And I'll show you how I go about doing that for my patients. Let's get this opened up here. Please tell me if you're feeling any discomfort at all. I do have to kind of widen the ear so that I can get in there. Okay. 1 second. Yeah, it can be a little bit testy. There we go. both my tools in here. And I'm going to go ahead and very gently scrape the plaque and tartar off of your teeth. We're working pretty primarily in the bottom right, the bottom left quadrant. My left, I guess. Yeah, well, I did need a lot more schooling because I needed to get my ENT license as well. Yeah, I do people with normal teeth all the time. But like I said, they can never talk to me, so I kind of really enjoy doing these cleanings. I also do all the cavity work. I'm technically not licensed to do extractions, though. It's weird. It's because of the anesthesia part. Yeah. I can use a topical, but you know, I get a lot of joy out of being able to do something unique like this that needs to be done. But it is definitely, dexterally speaking, if dexterally is a word, more difficult. But sometimes when we accomplish things that are more difficult, they bring us more fulfillment. Okay. Yeah, I'll show you some tips. So generally we use a special kind of flosser. You need to buy it through the office. Sometimes Amazon has them, but they don't they're not super overpriced. And you can reuse them a couple times if you wash them. But they're going to help you get in those back spots that you're kind of struggling with. So I'm noticing, like, right back here, quite a bit of build up right between these two teeth, and I'm guessing that you're missing them a lot with your flossing routine. You can also use a water pick on its lowest setting, but you need to be really careful because, you know, there's always the eardrum to watch out for. Yeah. Adjust this a little bit. Work on that other. We got a little bit of a chip here. Oh yeah, you need to be really careful with those kernels. I understand. When they came out with that like half-popped popcorn stuff, I love that stuff. And I was like, this is kind of encouraging people to eat something that's really bad for their teeth. Yeah, because everybody loved how crunchy it was, and so, you know, people would start making their own popcorn, eating the kernels. It can chip your tooth right off, man. You gotta be careful with that. Yeah. Okay. I think that's good. Let me grab my tube here. make sure I didn't miss anything. Okay. Oh, that looks great. Yeah, I got that. There was a really plaquey spot right there. I'm going to show you how to floss it in a minute here. Let me get the other side really quick. And then we'll floss and brush and you'll be out of here. Well, we can't do the polishing or the ultrasonic on people with your condition because of the damage it could do to the eardrum. So everything needs to be manual. So you're not getting, that polished clean. But I'm going to teach you how to brush so you can get that, okay? Okay, there's this one. It's a little bad here. 2 of the quadrants are where that 4 almost was. Yeah. No, it's nothing to worry about. It's all fixable with improved hygiene. I just need you brushing, twice a day, okay? I know when dentists tell you that, it's kind of like, come on, who does that? But it really makes a big difference. You don't even need to do the whole routine, okay? You don't need to use toothpaste even. Toothpaste is slightly a scam. It makes our mouth feel fresher, but it's really the action of rubbing something against that tooth, okay? So if you just want to do a dry brush after breakfast, a little bit of water, yeah, that's plenty. And then you can do the whole shebang at night. Flossing multiple times a day would be beneficial to you, but I'm not a fool. I know most people don't do that. I find that keeping little flossers by my computer desk can be really helpful in making me have better hygiene. Yeah, because I will just mindlessly floss my teeth sometimes. It's kind of the same thing as keeping a bag of chips by your desk. Just a lot healthier. But I have been known to do the latter. For sure. No doctor is free of vices, okay? Kind of like a lot of times we're just hoping that our patients do as we say and rather than do as we do. Not many people are a perfect example of anything, let alone hygiene. But I do try, and I develop thoughtful habits so that I don't look like a hypocrite when I tell people to do that. I think so. I'm just working on that second quadrant. It's looking good. Compared to other people, you have far less plaque and tartar buildup because the salivary stuff is way less in the ear than it is in the mouth. Like the tartar is just minerals from our saliva building up on our teeth. So you don't have as much to contend with there, so you're mostly dealing with food left over. Okay. Yeah, let me just enter a couple things here. Yeah, I just wanted to make a note. You have one part of the quadrant over here that I need to be careful with. You have a tooth that's slightly chipped. Yeah, it shouldn't be a concern. Like, I wouldn't worry about it, but you haven't had any pain on that quadrant, right? Okay, cool. For sure. Don't eat those kernels anymore, okay? Just leave them in the bowl, throw them in the garbage. I hate you wasting food too. Okay, there's this one spot. Let me just... There we go. No. Well, yes, I've been known to on occasion. Okay. We're good. We don't need the tube anymore. Your teeth are nice and clean, no polish required. But I'm going to go ahead and show you how we're floss your teeth, and I will floss your teeth for you, okay? This is a slightly adjusted to fit into your ear kind of floss stick, essentially. For me, I need two hands because it's not my own head and I need to steady myself. But you're just going to get in here and you're going to... Okay? And you use kind of a sawing like that, and then flick it up like that, okay? It's going to be hard on those teeth that I mentioned. Right. But I'm going to send you home with a free pack of these, okay? And you can wash them or use them if you want to. And they're fairly cheap to buy through us, okay? You don't even need an appointment. You can just come in. Okay, I'm going to turn it upside down. Get in there. You can also, if you need... Yeah, if you're finding difficulty getting in, we also have the tube thing that I was using to get in there. Yeah. And you can get one of those and use it to help you reach your teeth. But proper technique, if you develop that, you shouldn't need it, okay? Okay, just like that. Other side, go ahead and do. I can see that with the shape of your ear, why you're having a little trouble getting into that quadrant. Yeah, I'm a little more feeling like you would need it for this one. I'll just include one. They're really just a little plastic tube. It's not a big deal. Yeah, when I give you your pack. And you remember you gotta use a really special toothpaste when you use toothpaste, right? Yeah, we have some of that too, and I will send you with the test tube of it, a little sample tube. Yeah, you can't use the store brand stuff. It has stuff in there that can do some damage to your hearing. Honestly, it's not great in people's mouths either. Tastes good though. bottom one's easier. There's no reason you can't get this one right here. Yeah, almost there. Just getting these bottom ones. That one came right out. Just a sawing motion to get it in, and then make sure you're scraping against the sides there like that, okay? There you go. Okay, just like that, okay? And then I'm gonna send you home with one of these. This is a special brush, a toothbrush that we use specifically for people with your condition. This is gonna let you get all sides, every back and front of every tooth, okay? I'm just gonna show you how to use it, okay? Because it has brushes on every side. You can just go around like this. Full 2 minutes, okay? Every time. Especially for people like you, okay? Well, the density of the brushes, again, you can't use an electric brush in your ear. Sorry. That's what I usually suggest for all my other patients who don't have your condition. Electric toothbrush is going to do a better job than you can do. But that's not an option for you, okay? So you're going to have to make do with the manual. You see how I'm going around all the sides, back and front, on the top. This toothbrush also kind of allows you to get between your teeth if you have a big gap. You do not have any big gaps, so that's something you need to do. Yep, just like that. And I like to use this kind of like circular movement, like this. See? Yeah, like this. Yeah, that's what your best bet's gonna be, okay? 2 minutes every night. Ideally twice a day. Same on this side now. It might be wise to use your non-dominant hand for this. Well, the reach is going to be kind of a pain. I got you. Okay. Yeah, no, I understand. I'm fairly not ambidextrous. My left hand is klutz. And yeah, that could be dangerous, so I rescind my advice. Make sure you get in the back of this one. This corner right here is giving you trouble, okay? I want to see full brushing on this side. Just like that. You can spin the brush like this, too. Yeah, that can help sometimes for hard to reach places. Yep, just like that. Every surface, okay? Yeah, for sure. It's a challenge, but you're doing a really good job. I don't want to impugn your efforts because your teeth look really good. So if you want to follow me out, we'll give you your little grab bag and I'll put some extra flossers in there and the special toothbrush, okay? And when you need refills, just come to us. I promise it's not super expensive, okay?